Hi guys, welcome to our YouTube channel. Today we're gonna talk about angina pectoris. So if you are interested in this topic and you are interested to know more about it, be with us until the end of this video. Angina is chest pain or discomfort that happens when your heart isn't receiving enough oxygen-rich blood. As a result, your heart may beat faster and harder to gain more blood, causing you noticeable pain. Angina isn't a disease. It's a symptom and a warning sign of heart disease. About 10 million people in the US experience angina. So if you have this symptom, you're certainly not alone. It's important to learn more about angina, what causes it, and how to manage it in your daily life. Angina can be a warning sign of a heart attack. If you have unexpected or severe chest pain, call 911 right away. Most people with angina describe having chest pain or pressure, or they describe a squeezing sensation or tightness in their chest. Some people say it feels like indigestion. Others say it's hard to describe angina with words. The discomfort usually begins behind your breastbone. Sometimes you may not be able to locate exactly where the pain is coming from. Pain or discomfort you feel in your chest may spread to other parts of your upper body. These include your neck, jaw, shoulders, arms, back, or belly. Lack of oxygen to your heart can cause other symptoms known as angina equivalents. These are symptoms that you don't feel in your chest, including fatigue, nausea or vomiting, shortness of breath, sweating a lot. There are four main types of angina: stable angina, unstable angina, microvascular angina, and principal angina. Angina pectoris is another name for stable angina. It refers to brief chest pain or discomfort that comes and goes in predictable patterns. Both angina and a heart attack are consequences of coronary artery disease, but angina doesn't cause permanent damage to your heart. A heart attack does. That's because angina signals a temporary reduction in blood flow to your heart. A heart attack causes a longer reduction in blood flow. During that time, part of your heart muscle begins to die. Another key difference is what makes the pain go away. Rest or medication causes a stable angina to go away within a few minutes. However, if you're having a heart attack, rest or medication won't ease your symptoms. A stable angina doesn't require emergency care unless your pain suddenly gets worse or doesn't go away with rest or medication. A heart attack is a life-threatening emergency that needs immediate medical attention. There's nothing you can do on your own to make it better. That's why it's important to talk with a healthcare provider about your angina and learn what's normal for you. Ask your provider what's out of the ordinary for you and when you should call 911. Reduced blood flow to your heart causes angina. Several problems with your coronary arteries can prevent your heart from receiving enough blood. These include coronary artery disease (CAD). This is the most common cause of angina. It happens when plaque builds up in your coronary arteries, which supply blood to your heart. These arteries narrow or harden, reducing blood flow to your heart. Coronary microvascular disease. This condition is more common among women and people assigned female at birth, AFAB, compared with men and people assigned male at birth, AMAB. It damages the walls of tiny blood vessels that branch from your coronary arteries. These blood vessels aren't seen on typical testing for CAD and require special testing that's not available at all medical centers. Coronary artery spasm. Your coronary arteries repeatedly constrict, then open up. These spasms temporarily restrict blood flow to your heart. You can have coronary spasm without having coronary artery disease. This may not be diagnosed with routine testing for CAD and may require special testing that's not available at all medical centers. Your healthcare provider will treat the underlying heart problems that causing your angina. The goals of treatment are to improve blood flow to your heart and lower your risk of complications. Your provider will give you a physical exam and perform testing to learn more about your condition and determine the best treatments. Common treatment options include anticoagulant or antiplatelet medications to lower your risk of blood clots, blood pressure medications, cholesterol medications, medications used to treat angina, lifestyle changes, coronary artery bypass grafting, percutaneous coronary intervention, also called coronary angioplasty, and stenting. Even with treatment, some people still experience angina. Your provider may prescribe a medication to quickly open your blood vessels when you have pain. Nitroglycerin is a common angina medication. Talk with your healthcare provider about how to manage angina in your daily life. They'll offer advice based on the type of angina you have and what's causing it. Some general tips include keep a log of your angina episodes, including the date and time, what it felt like, and possible triggers. Also include the pain level on a scale of 1 to 10. Share the log with your provider. Know when to call to emergency help. Take medications as prescribed to treat your angina. Try to avoid the triggers that lead to an angina attack. Talk with your provider about which activities are safe for you. Many people can continue their normal routine but should keep medication with them in case of an angina attack. You may need to reduce heavy lifting that could trigger an angina attack, but your provider will offer guidance based on your individual situations. Thank you for being with us until the end of this video. I hope this video helps you to know more about angina and ways of treating it. Don't forget to subscribe our channel and see our other videos.